Greetings, Dr. David Webb with Georgia Pain and Spine Institute. Wanted to come to you today to talk about an ailment that results in significant low back pain in many individuals, and that is a herniated disc. What is a herniated disc? A herniated disc refers to a problem with one of the rubbery cushions, called the disc, that sits between vertebral bodies or the spine. Now, these discs and the vertebral bodies help provide support and structure to the body. However, when that disc becomes problematic, it can result in significant pain. Let's talk about the makeup of the disc. So the disc consists of a jelly-like inner substance called the nucleus and a thick exterior called an annulus. When the nucleus actually protrudes through the annulus, it results in a herniation. Sometimes herniations are called slip disc, sometimes they're called protrusions, but they all kind of mean the same thing. Now, a herniated disc can result in significant pain, numbness, tingling, burning sensation in the neck, in the low back, and they can travel down the arms and legs. A herniated disc sometimes may not result in any pain, and individuals may not know they have it until they have an MRI or a CT scan that shows them that they have a herniated disc. And if you're not having any problems, there's really no treatment that's needed at that time. Now, what are some of the symptoms of a herniated disc? So if a herniated disc occurs in the low back, some of the symptoms they may experience are pain traveling to the buttocks, into the thighs, and into the pelvic region. Sometimes pain actually travels down the leg and below the knee into the calf muscles, and at times in the foot. This pain is a numbness, tingling, burning sensation. In the neck, symptoms can consist of burning and numbness running into the arms, into the shoulders, and actually traveling down into the hand. Now, this numbness and tingling does not always occur. And so, again, some individuals may have a herniated disc and not have any symptoms. One of the biggest concerns is that associated weakness that comes with someone having a herniated disc. Because the nerve is affected, the muscles that what we call are innervated or supplied by that nerve can unfortunately become compromised. And if weakness takes place, individuals may not be able to walk, they may be falling, individuals may actually try to pick up objects and drop them. And these are types of problems that result in individuals having to go to the hospital and get treatment. Again, if you have symptoms of a herniated disc, such as numbness and tingling, weakness, arm and leg pain, you need to seek medical care. Now, let's talk a little bit about the causes of a disc herniation. So a disc herniation is often caused by gradual deterioration of the bone or gradual deterioration of the disc. Once this deterioration takes place, a tear can ensue, and a wear and tear then results in the herniation. Now, as discs become much what we call older, they're more susceptible to this wear and tear. So herniated discs are commonly seen in individuals that are older, but younger individuals also have herniated discs. Another cause is improper lifting. Lifting with the back muscles only or twisting violently can result in a herniated disc. You must use your legs and you must use your thigh muscles in addition to your back muscles when lifting. And proper form can help reduce developing a herniated disc. There are also some traumatic injuries such as a motor vehicle, car accident, horseback riding, or any significant fall that can result in herniated disc. So let's talk about some of the risk factors. One of the common risk factors is excessive weight gain. Weight gain or excessive obesity or enlarged truncal aspect of the body can cause significant wear and tear and discomfort to the back. You have more weight, unfortunately, causes more stress to the back. Also, another risk factor is occupation. Some individuals who must lift heavy objects, who have occupations that require significant bending or picking up heavy objects or flexion, or individuals who unfortunately are placed in situations such as contract work, they usually are at an increased risk of developing a herniated disc. Unfortunately, one of the common risk factors is genetics. Nothing you nor I can do about it. and we can only thank our parents for that. Smoking is another contributing factor. The theory is that when one smokes, there's a decreased oxygen supply to the disc. This decreased oxygen supply, unfortunately, can result in readily aggravation and acceleration of disc degeneration, leading to a herniated disc. Now, there's some complications with herniated disc that we need to talk about. If you have worsening symptoms, such as significant pain, discomfort, that is not alleviated or reduced with treatment, you might need to be evaluated, or rather you need to be evaluated by a physician or your provider. Another medical emergency is called Cauda equina syndrome. Now, Cauda equina syndrome presents with bladder or bowel dysfunction. Usually individuals will look down and they'll be wet themselves, and they no longer can control their ability to either urinate when they desire, or they may have dysfunction of the bowel and may stool themselves. This is a medical emergency, and you need to be seen in the emergency room immediately. Another cause of herniated disc is Satto anesthesia. Imagine yourself riding a saddle on a horse. The part of the buttocks that sits on the horse is called the saddle, and this area can become numb and tingle, such as in the pelvic region, the anal region, and in the buttocks region. And it is a common cause of herniated disc, specifically in the low back. So how do we prevent these symptoms from taking place? Number one, exercise. It is very important to strengthen the muscles in the neck, the abdomen, and the low back. They provide the structure and support overall to the spine. Maintaining good posture is also important. Maintaining a reduced weight or an appropriate weight, and most importantly, smoking cessation. So, we need to talk about diagnosis. Now, there are many ways to diagnose a herniated disc, but the number one way is via a physical exam. Your physician or provider should perform an extensive physical exam, including a neurological assessment, to determine if you may have a herniated disc. This neurological assessment consists of evaluating reflexes, muscle strength, walking ability, and also what we call the ability to feel sensation, or also known as pinprick, vibration, and proprioception. Other tests that may be performed. Once you suspect that you have a herniated disc, you need to have it confirmed by some type of imaging. Now, an x-ray can be performed, but an x-ray is not going to detail if you have a herniated disc. What an x-ray will tell is if there's another cause or potential cause of this back pain or neck pain. X-rays can rule out other causes such as degeneration to the what we call the facet joints in the back, significant arthritis in the back, and unfortunately what we call compression fractures or fractures of the vertebrae. Other tests to be performed include a CT scan, an MRI, and also a myelogram. When a myelogram is performed, there's dye placed in the spinal fluid, and the radiologist is able to actually see if there's compression from the disc on the nerves. There's some nerve tests that can be performed. One is a nerve conduction study, where needles are placed at the nerves, and they overall will detect if there is a prolonged or delayed response from the nerve, and also electromyography or EMG studies where muscles are detected. And again, these muscles are innervated by nerves that potentially could be affected by a herniated disc. So let's talk about the treatment. You've now been diagnosed with a herniated disc. What's next? Well, the first thing you may think of is, let me go lay on the couch and lay in the bed and not do much. But avoiding excessive activity is important. However, staying active is also very important, because studies have shown individuals who don't get any activity have increased problems with herniated disc. They have significant muscle spasms, and their ability to get well is delayed significantly. Heat and cold therapy can be utilized, and also, again, staying very active. That's where physical therapy, I believe, is very, very important. With physical therapy, a therapist is able to provide exercises to help strengthen the muscles in the cervical region or neck region, and the low back region, and also of the abdominal core region. Now, let's say we've tried essentially everything. The next step is medications. First line is what we call over-the-counter medications, anti-inflammatories such as Aleve, or what we call antipyretics or Tylenol. Then we will want to consider, if over-the-counter medication is not beneficial, what we call cortisone or steroid injections. So steroids can be placed at the site near the nerve that is affected by the disc or near the area of the spine and help reduce not only pain, but also the inflammation that is caused by the herniated disc. It's not going to fix the herniated disc, but if you can reduce the pain, you're then more apt to take part in physical therapy and activity and strengthening up the muscles of the back. Now, let's say everything has been tried and nothing is beneficial. You then may have to try some pain medication or opioids. Now, last line of treatment is surgery. For individuals that need to have surgery, there's some indications where surgery is definitely needed. A, pain is poorly controlled and is affecting the overall quality of life. B, numbness and weakness has ensued and the individual is unable to pick up objects, able to walk, and at risk for losing or potentially significant disruption to an extremity. Also, the ability of someone or the inability of someone not to be able to control their bladder or their bowel. That is a medical emergency. Treatment will be needed if it is a true emergency. If it is a true presentation, will be needed immediately. Now, alternative treatments, we can consider chiropractic therapy, acupuncture, and massage. And overall, the majority of individuals will get relief, will avoid surgery. However, there is a subset of individuals that may need surgery. You should seek counsel and discussion with your physician or provider if you're having these problems. And also, if you are in the Atlanta area, Decatur area, you can always give myself a call at Georgia Pain and Spine Institute. I'm also known as Pain Man MD. If you're having low back pain and you think you might have a herniated disc, give me a call. Area code 678-383-7246. Again, 678-383-7246, and I can be reached on the World Wide Web at www.gapainandspine.com. And remember, at Georgia Pain and Spine Institute, we believe one motto, one mission, one goal, pain-free. Thank you very much.